Good afternoon. I am Kenya Kirkendoll,
And I'm Joan Cranford.
and we are here to answer the questions that you had concerning blood pressure, IM injections, and temperature. We're glad that you enjoyed the video, and we appreciate your feedback, and you had great questions. However, we only have a limited amount of time and we'll only be able to answer a few questions. All right, the first question that I will be addressing is a question about the best way to measure body temperature. The most accurate way to measure body temperature is using a thermometer. And as we mentioned in the video, there are several different types of thermometers that can be used. You can use an oral thermometer, which goes in the mouth, or you can use a tympanic thermometer, which they have digital thermometers that are placed in the ear. And then there's also, I guess these are a more new device, but a temperature that can be, a thermometer that can be used on the forehead. So there are different types of thermometers that can be used, but the most accurate way to get a temperature is with a thermometer. Placing your hand on an individual's skin and trying to measure body temperature that way is not recommended, because depending upon the temperature in the room, the temperature outside, it may influence how the skin feels and may lead you in the wrong direction in terms of determining the person's temperature. So the best way to measure a temperature, body temperature, is with a thermometer.
The second question addresses intramuscular injections. The question was whether or not only doctors are allowed to give injections in the gluteus maximus. That is not correct. In the United States, nurses are allowed to give injections, all types of injections, IM, sub-Q, but IM injections can be given in the gluteus maximus. And there's several questions about the sciatic nerve. This is very rarely a complication because we have landmarks, and if you follow those landmarks, you will not come in contact with the sciatic nerve. Another question about injections was, what do you do if you see blood when you aspirate or you see it coming into the syringe as you inject the patient? It is highly recommended that anytime you see blood in your syringe, you discard that medication and start again and get new medication, new syringe, start the procedure again, because technically that medication is not contaminated.
So we will be answering the remaining questions in the next video.